Hi, my name is Dr. Hyder. I'm a board-certified fellowship-trained spine surgeon at Bone and Joint Specialists. The goal at Bone and Joint is to return our patients to a productive and pain-free activity using the most advanced, minimally invasive and motion-preserving techniques, holding surgery as a last option. For the last 4 years, we've been improving our patients' lives by bringing minimally invasive spine surgery to Northwest Indiana. In this video, I'll explain what minimally invasive surgery means, how the entire procedure will go from start to finish, how it compares to prior surgical methods, and the overall benefits of minimally invasive surgery. An MIS TLIF, or a minimally invasive surgical transforaminal lumbar interbody fusion, is performed to remove disc material and bone spurs that are pressing on one or more of the nerves in your back. Once the disc is completely removed and the pressure is taken off the nerve, an artificial spacer takes its place so that it may fuse to the vertebrae in the spine over time. The unstable bones that cause the back pain are then brought back into position and held in place with small screws. The remarkable thing is the whole procedure is done through 2 3-centimeter incisions utilizing a tube and a muscle-sparing approach. During the day of your surgery, the anesthesiologist will bring you into the operating room and put you to sleep for the operation. Once you have been positioned on the operating room table, I will make a single small incision in your back about 3 to 4 inches from the middle of your spine. For a single level fusion, the incision is typically 3 centimeters in length. An X-ray machine, or also called a fluoroscope, is then used to image the spine. Dilating tubes are then placed through the incision onto the facet joint. The tubes then separate the muscle fibers and provide access to the spine without cutting through the muscle. A retractor is then placed over the final tube to hold the muscle tissue out of the way. Through the retractor, we are able to remove bone spurs that are pressing on the nerves. This also gives me access to the disc. Special instruments are then used to remove the majority of the disc material, creating a space between the vertebrae. A bone graft or a fusion cage is then placed and the fusion is allowed to occur. This restores the natural height of the disc base and provides the stability as it fuses. Next, titanium screws are placed into the vertebrae above and below the disc through columns of bones called pedicles. Guide wires are then placed into the pedicles using X-ray guidance, and screws are then placed over the guide wires and placed into the pedicles. After the screws have been placed, the guide wires are removed. A second incision may be made on the opposite side of the spine for additional support. The incisions are closed then with absorbable sutures that are placed under the skin. A typical minimally invasive transforaminal interbody fusion may last approximately 1 to 2 hours. What does this all mean to you? Through the use of modern-day technological advancements, I am able to accomplish all of the goals of the traditional open surgery with less blood loss. Usually a patient will lose about 600 milliliters of blood. The minimally invasive surgery approximately loses about 50 milliliters. There's less postoperative pain because it is not a muscle cutting procedure, it is a muscle splitting procedure. The recovery is much faster and the incisions are much smaller. Because of the smaller incisions, there's less risk of infection and blood loss. Suffering from back and leg pain can be debilitating in many people's lives. It may prevent you from enjoying leisurely activities like golf and tennis, make it hard and painful to walk, and interfere with your occupation. In the vast majority of our patients, we can avoid surgery altogether and heal patients with conservative techniques.